I'm very lucky to be in a country which has had an extraordinary response and has a very, very good approach to this crisis that everybody has. And we think we're seeing a response to their early shutdown. They were very aggressive. They have a long history of keeping biohazards out. Fruit and vegetables are a very big thing here, and they have a good system at their borders. But they switched very quickly to try to control the influx of coronavirus. And when they started noticing the first case of community transfer couldn't be traced to somebody coming in with the disease, they clamped down, immediately went from level 2 to level 4 in 2 days. And we've been in pretty much complete shutdown for now almost 2 and a little bit more weeks, planning to do it for another 2 weeks. They've seen their cases go down, and they hope to stamp out the remaining cases. They've had only 2 deaths, both in elderly, one in a nursing home cluster. But they've had a beautiful system, one which I think should be a model for others to copy in terms of the distribution of information by their prime minister, the collaboration of all the levels of both ministerial. The opposition party has joined in and held back from commenting where they might otherwise take advantage of slips, and worked all together. The system is just really working in ways that are quite enviable and quite beautiful. And of course, they have a very nice health system to begin with, where everybody is covered by essentially a national health service of sorts. They have local departments of health which distribute the care. They do have a private system which is overlaid on that, but essentially everybody is covered for the minimum. And they're putting out some very nice efforts right now through that at getting everybody their flu shots, because here, of course, we're entering winter as opposed, we're in fall and entering winter, and so the flu season is upon us, and so they're trying to get everybody vaccinated to try and not add to the burden of the hospitals. Their hospitals are gearing up for what we hope may never happen, which is an overwhelming influx of coronavirus patients. They've had, I think, 1,200 so far in the country, of whom only a small number have been sick and enough to be in intensive care. But overall, I'm very impressed with not only the health part of it, but the collaboration with industry, with sourcing, with supplies, with immigration. Just everything is working in ways that I only wish we could duplicate elsewhere.